Asthma affects both children and adults and is the most common chronic disease amongst children. According to latest studies, asthma affects more than 300 million patients around the world and across all age groups. So Dr. Carroll, perhaps we could just start by talking through the pathophysiology so we can get an understanding of how these therapeutic agents tackle the disease. So what do we see in this disease?
So asthma is an inflammatory condition. You can't actually see very much going on. So asthma is like eczema of the lungs. And with eczema, of course, you can see on the skin that it's red, it's sore, it's inflamed. But with asthma, you can't really see the lungs. And the inflammation in the airway leads to it being narrowed because of the swelling from the inflammation, but also being narrowed because the airways themselves are quite twitchy and reactive, and triggers like cold air or dust will then cause them to go into spasm. And that spasm can be relieved by using inhalers, and the inflammation can be relieved by using inhalers. The tricky bit is knowing whether it's spasm of the airways or whether it's inflammation of the airways and knowing which medicine to use. And that actually can be quite difficult to work out. There are different types of preventers and different types of inhalers, but all the rescue medicines, all the relievers are blue, like this.
So many people, I think something like 80%, don't actually use the inhalers correctly, and many people don't even realise whether there is actually active drug in the inhaler or not.
It's really easy to get things wrong. It's very difficult to take regular medicines. All patients struggle with taking regular medicines of any sort, but the more complicated it is to take the medicine, the more difficult it is to do. How they take it and making sure they're doing it correctly. Does the inhaler have any medicine in it?
Particularly in children, obviously making sure that they have really good technique and the use of a spacer device is certainly of benefit, isn't it?
Absolutely. The medicine comes out of here at 70 miles an hour. And if you've ever stuck your head out of your car window at 70 miles an hour, you know, it's really difficult to get your breath in. It's definitely difficult to get your inhaled medicine in. Of course, it slows exponentially. So it slows really quite quickly. And when it's traveled about 12 centimeters, you can start to inhale some of that medicine. So for all children, we recommend using spacers. And in fact, it's the best way of making sure you get your medicine in well. And it's really simple to use a spacer, and it's really quick. And there are only a few important steps. The first is, and bizarre though I have to tell people, it's remove the caps, shake the device, fit the device to the spacer, and then chin up. Really important to have the chin up. We're going to do sideways on hand. Chin up. And then bite and seal. And then we press and breathe.
So just tell me, so that's obviously the parent's worst nightmare, is not knowing whether the inhaler has any active drug in it. And you shake it, it might feel like it's got some active drug in it. Surely there must be a better way in this day and age where you can see how many active doses are left in that particular inhaler. Isn't that the way to go forward?
Patients all tell, not unreasonably, that their inhalers are empty by the following mechanism. They shake it, they spray it, and they see something come out, which is why I moved the inhaler down so you could see something come out, and they go, must have medicine in it. Makes a noise. I can actually smell the spray here, and they can see and smell the spray, and they go, that must be medicine. So the first 200 puffs that come out of this inhaler have drug in. The next 100, and there are a further 100 doses, will have maybe some drug in for a few puffs, but then just propellant.
What's your final message? Is it that actually we should mandate inhalers have dose counters on them?
That may not be in my gift, but I think what we can do is we can send a clear message to all of the parents, all of those who are looking after themselves with asthma or looking after other people with asthma, is it's really important to count it out. If you've got puffers without counters, then you need to have some way of counting. That may be a simple manual system of marking it off on the packaging, but it has to be done because relying on the noise is an unreliable method.